We should be good in a second. Testing for the media, testing 1, 2, 3. Awesome. It should be. Testing 1, 2, 3, testing the microphone. Testing 1, 2, 3. Testing 1, 2, 3, microphone check. Okay. Testing 1, 2, 3. One more time. Testing 1, 2, 3. Testing 1, 2, 3. We're good? We're good.
Can we try? Okay, thumbs up, everyone. All right, good morning. Welcome to our COVID briefing for Thursday, February 4th, 2020. Today, our speakers will be our Governor, Spencer Cox, Lieutenant Governor Deidre Henderson, and Dr. Angela Dunn. Governor Cox.
Thank you, Joe. Ladies and gentlemen, it's great to be with you again. We're through another week. Appreciate all of you joining us today. Hope you've had a good week and a safe week, and I hope lots of you have gotten vaccinated. Those over the age of 70, and we know that you have, which is really good news. We're excited that as of this morning. approximately 35% of all of our seniors, 70 years of age and over, have been vaccinated. That's about 84,000 of you. So and that's just in a couple weeks. So we are well on our way again to getting those that are most at risk vaccinated and saving lives. We're excited, of course, to see our numbers come down, and Dr. Dunn will be talking more about that. So just want to share we've got a lot to get through today. So be patient. Please pay close attention because we have several announcements that we want to make. So first of all, we have administered now 362,701 doses. Those are first and second doses combined. That's a weekly increase of 95,674 doses. Every week, our numbers go up significantly, and that's the great work of our local health departments and others who are engaged in this effort. Also today, we reached a really important milestone. We have now administered more doses than the number of people who have tested positive for COVID in our state. And again, I want to thank our local healthcare providers and local health departments in this effort. Just those numbers today, total cases as of today will be 351,000 and total doses administered over 362,000. So basically, we are trying to be more viral than the virus, and it's happening. All vaccines, Pfizer, Moderna, and the upcoming Johnson & Johnson vaccine are incredibly effective. We're starting to hear, again, people saying, well, there's 70% effective rate versus 90% effective rates. But we really want everyone to know that any vaccine is going to help you stay better and get us back to normal more quickly. In fact, every one of these vaccines so far has been 100% effective against hospitalization and death. And those are the two things we're most worried about. We're not as worried about mild disease, but we're most worried about hospitalizations and death. And 100% so far is a pretty good number there, and we're excited about that. Now, federal government has made several announcements, and we want to share those with you, as well as, and I always want to be cautious, I want to share projections for March and April. Now, again, the caveat being these are just projections. Nothing is official until we actually get doses sent and approval is granted to the new vaccine. But assuming those vaccine approvals are received by the FDA, we want to share what we're looking at hypothetically what those numbers could be. So first of all, on February 2nd, the federal government announced that they are increasing vaccines by an additional 5% to the state of Utah. That's in addition to the 16% that we announced last week. So we went from about 33,000 doses a week to about 40,000 doses a week, and then an additional amount on top of that. So we're looking at this week about 42,000 doses. Plus, you'll remember we were able to get thousands of doses back from some of our federal partners that we had talked about last week. So we're really looking this week at about 50,000 doses coming to the state of Utah, which is great news. In addition, all Pfizer vaccination kits are now going to ship with the equipment and syringe needed for that elusive sixth dose that we're talking about. So these vials were meant to contain 5, but there's always a little extra in there. We can get 6 out. We've been getting 6 out of them, but now they're actually including the equipment so that we can get that sixth dose out, which means an additional 20% on top of again, those new doses that are shipping. The federal government is also committed, as we've mentioned before, to providing a 3-week forward visibility into supply. This is absolutely critical for what we're doing in our planning efforts, and this is what we have been asking for. So I want to share now some of what we're looking for in coming up in March and April, because it's even better than what I had hoped for before. So, as I mentioned, first doses delivered or in transit, we've got about 50,000 doses, including the doses that we took back from some of those federal partners. We have second doses delivered or in transit of about 34,000 this week. And so here's what we're looking at going forward. Production is ramping up at the federal level. I mentioned the 5% bump, but we anticipate that we will continue to see these small increases each week. But here's the most exciting thing. At this point, we believe we could go from receiving total first and second doses of about 82,000 that we're receiving this week to starting in March, 195,000 total doses, first and second doses per week, just based on Pfizer and Moderna increases and their delivery commitments to the federal government. Now, again, I want to be very clear that these are just projections, but they're important projections because it allows us to start planning for huge increases in March and April. In addition to that 195,000 first and second doses from Pfizer and Moderna, we are planning on receiving 33,000 doses from Johnson & Johnson per week beginning sometime in the first half of March. So now you can envision in March, we'll be receiving over 130,000 first doses. And of course, the Johnson & Johnson vaccine is just a first dose vaccine. 130,000 doses in the first week of March, up from 33,000 that we were receiving per week just last week. That does not include AstraZeneca, which again, anticipating in the first week of April, could bring an additional 84,000 doses into the state per week. After that, we will be receiving over 300 first and second thousand doses per week. So to go from 33,000 a week to 130 and close to 150 to 200,000 doses per week in April just changes the ball game for all of us. And that's what we are planning for. That's what we are preparing for. And that leads us to our next announcement. Now, I just have to say up front, and I want to really set expectations. When we go from 33,000 doses a week to 130,000 doses a week, that means a huge expansion in the different partners that we will be working with. We are in the process right now of reaching out to those partners. We have a high throughput coalition that is working on mass vaccination sites. There will be scheduling issues. There will be different schedulers for all kinds of different partners. There will be different platforms. There will be lots of people trying to figure out where they can get online and inline to receive these vaccines. There's going to be, in every state, in every country in the world, there's going to be a little bit of chaos in making all of this happen. And we are going to embrace that chaos. We're going to solve that chaos. And we are going to get shots in arms within 7 days of receiving that vaccine, and we are going to continue to save lives. We appreciate your patience in all of this, and appreciate our partners that are going to be working day and night, literally around the clock, to make this happen and to be prepared for those huge increases. With that, as promised, as I mentioned, we have 84,000 of our seniors over the age of 70 and older who have been vaccinated so far. Over the next 3 weeks, we will be completing the rest of our seniors. There's about 241,000 in Utah in the population that are 70 and over. So that gives you an idea. You can start to look at those numbers and realizing, okay, in the next 2 to 3 weeks, we're going to be finishing up that group of people and need to move on to the next phase. Now, what I am going to announce today is new eligibility starting on March 1st. Let me be very clear, and our media partners, we really need your help in making this happen. I'm going to announce it today just so people can start to know where they're going to be on the list and when they'll be able to get their vaccines. Please do not contact your local health department right now. This is not eligibility today. It's eligibility on March 1st. We know there will be questions about some of these subcategories. We will try to answer those questions. There will be clarifications sent out over the next 3 weeks. We will get as detailed as we possibly can about who qualifies. And so, again, I can't emphasize this enough. Please, please, please know that you don't go and schedule right now. We are not opening scheduling right now for these categories, but just know that you are next on the list, again, starting on March 1st. So I mentioned the next phase, we will be lowering Again, starting on March 1st, eligibility from 70 and over to 65 and over. So everyone in the state who is 65 years or older, starting on March 1st, will be eligible, along with the following comorbidities. And Dr. Dunn is going to join us after I finish here to talk through a little bit of the thought process that the health department has gone through in picking these. These are the comorbidities, or people with underlying health conditions that are the most at risk. This is not every comorbidity. It is not every at-risk person. We recognize that. This is a population, when you include these comorbidities as well as the 65 plus, it's about 400,000 people in the state. Now, again, when we're receiving 130 to 150,000 doses per week, we should be able to get through this population in about 3 weeks. So then you can see, then we move to the next age and the next comorbidities. That means that by, through March and through April, everyone that's at high risk or moderate risk should be able to get a vaccine at the rates we're looking at now. But let me go into these comorbidities. And I'm going to state broad levels. There will be specifics within each of these. We will send that out. We will, again, try to make it as clear as possible to everyone so you will know if you fit into one of these categories. Here are the broad categories. Solid organ transplant recipients. And by the way, again, this is everyone age 18 and over with any of these conditions, ages 18 and over. So solid organ transplant recipients, certain cancers, again, not every cancer, but certain cancers that are the highest risk, and we will get that information. Those in an immunocompromised state with a weakened immune system from blood, bone marrow, or organ transplant, HIV, use of corticosteroids, somebody with an MD will describe that to you, or use of other immune weakening medicines long term. Severe kidney disease on dialysis or with stage 4 or 5 chronic kidney disease. Those with uncontrolled diabetes. Those with severe obesity. That's a BMI of 40 or greater. Chronic liver disease, including chronic hepatitis B or C, chronic heart disease, but not hypertension, severe chronic respiratory disease other than asthma, neurologic conditions that impair respiratory function, including Down syndrome, multiple sclerosis, Parkinson's disease, cerebral palsy, quadriplegia, or hemiplegia, stroke and dementia, including Alzheimer's, vascular, and frontotemporal, and asplenia, including a splenectomy or a spleen dysfunction, including sickle cell disease. Now, I know there are a whole bunch of people who listened to that list and thought, I'm so close, I'm not on that list, and that's going to be very frustrating. Again, we understand. Unfortunately, what we've had to do is take the best medical evidence available, those in the highest risk, and based on the supply of vaccine that we have. Again, this population is about 400,000 people. We expect with the numbers that we're seeing in March, we'll be able to get through this population very quickly and then move on to the next population that will likely include you if you have some of the other comorbidities that are out there. I will emphasize this again for the 10th time. Please, please, please do not contact your local health department or try to schedule if you are in one of those categories. That will all change, and that will all begin starting March 1st. We will have additional information coming to you over the next few weeks, but I hope you understand the really good news about the significant surge of vaccines that we have coming and the significant increase in population. And the good news is this will allow us to get back to normal more quickly as we save the lives of those who are most vulnerable. We decrease hospitalizations, and we get prepared for even more vaccines coming in April and May. With that, I'm excited to turn the time over to Dr. Dunn to add a little more context on where we are with the pandemic and about some of these announcements today. Dr. Dunn.
Good morning. So first, an update of where we are in the pandemic. Our rolling 7-day average of new cases is now at 1,000 264. This is a decrease from last week when it was at 1,710, and our percent positivity continues to decrease as well. We are at 16.5%, and last week we were at 18.3%. So all very good signs. And it's even more exciting that we're able to increase our eligibility for vaccinations again starting March 1st. Our local health departments and our state health department are going to really focus the rest of February on getting vaccines to those 70 and older. So again, please do not contact them about eligibility starting March 1st. We really want to allow them to use all of their resources to finish vaccinating those that are 70 and over. All of the information that Governor Cox discussed before this is on our website. So you can go to our website, coronavirus.utah.gov, to learn more about the conditions that will be eligible for vaccination starting March 1st. It's exciting that we're able to do this. It's based on projections from the federal government on vaccine supply, including the Johnson & Johnson vaccine, which is expected to be approved here soon. And on the vaccine the Johnson & Johnson vaccine, just want to take a minute to explain kind of its efficacy and what's been said in the media. You know, unfortunately, national media comparisons between the Johnson & Johnson effectiveness with Moderna and Pfizer have been a little misinformed. The clinical trials between the vaccines were designed differently. The Moderna and Pfizer both tested for symptomatic infection due to COVID-19, whereas the Johnson & Johnson trials tested for moderate to severe illness. And Johnson & Johnson proved to be effective at preventing 72% of US individuals against COVID-19 infection. And it's 85% effective against severe disease only. And that's really exciting. As Governor Cox said, we're aiming to prevent hospitalizations and deaths, and the Johnson & Johnson vaccine does just that. So it's very important that once the vaccine becomes available, that we all, when it becomes our turn to take the vaccine, we all get the vaccine, whether it's Johnson & Johnson, Moderna, or Pfizer. Lastly, I just want to note that our dashboard will have updates today, especially on the vaccine tab. You will be able to see vaccinations broken down by specific demographics, including sex, age, and race and ethnicity, so that that is available for you to look at now on the dashboard. Thank you very much.
Good morning. Thank you. I want to talk a little bit about our new federal partnerships that were announced from the Biden administration this week. This is going to be given to us, to states, on top of the regular weekly doses that are given to states. So the federal government has partnered with Walmart's and Smith's locations, Smith's pharmacies in the state of Utah. We have 29 Smith's locations and 18 Walmart locations that will be receiving a total of 6,500 new doses this week on top of our weekly allocation, which is really exciting. That will be starting next week, the end of next week. So starting on February 11th, you'll be able to start calling specific pharmacies, Smith's and Walmart pharmacies, to be able to get appointments there. The good piece of this news is that the state actually has control over who is eligible to receive those vaccines. So they're letting us determine who gets to use those vaccines in each of those pharmacy locations. Again, we'll have more specific information in the coming days about where exactly those locations are in the state of Utah. But this is good news on top of other good news that we've had this week. So we're hoping the people who already have appointments through their local health department will keep those appointments and not go get another appointment from a Smith's or a Walmart, and then kind of upset the system by not showing up to an appointment that they had previously scheduled. We're also hoping that people stay in their counties that they live in, stay in their locations. But again, more information is forthcoming on exactly what this is going to look like. As the governor mentioned, by March 1st, we're going to have a significant increase in the number of doses that the state gets every week. And our local health departments have just been doing a heroic job of getting these vaccines in arms every single week. And again, we're at 100% again of vaccines that are less than 7 days old in arms. But we're working with them to make sure that they're reaching a sustainable capacity. And then we have a high throughput coalition that is working to make sure that we are reaching out to other community partners. We've got hospitals, local health departments, businesses, pharmacies, and health systems that are coming on board to make sure that we have locations and staffing and all of the things that we need to be able to ramp up to meet the supply when that supply gets here. So we've been working really hard on that. Now, this effort is going to require many, many hands, more hands than we can just hire, and we will be needing volunteers. However, in the coming days, we'll have information for anybody who wants to volunteer to be able to sign up to provide services, whether it's helping to administer shots, whether it's helping with traffic flow or data entry or any of the phone banks, any of the other things that we're going to need to really mount this monumental effort. I don't have a number to give you today, so don't call anyone today, but in the coming days, there will be information. So if you've been wanting to volunteer, please keep watch because we're going to need you. And I just want to reiterate the message that the governor already said, which is please be patient. We are going to do something incredible here, but it's not going to be easy and it's not going to be smooth. There are going to be a lot of bumps in the road and there will be frustrations, but that's the trade-off. And we're doing something really important, and we ask for you to please be patient and really thank the people that you come in contact with who have been working nonstop to provide these services, especially our local health departments over the past few weeks who have just been incredible. Thank you so much.
Thank you, Lieutenant Governor, and thank you, Dr. Dunn. I recognize that we went a little longer in our presentation today, and I want to make sure we have enough time to answer some more questions. So I'll just let my staff know we'll go a little past the time so we can get a few more questions in.
Yes, this is Tamara Baifanua with Fox 13. Hello, Governor Cox. I just wanted to get your position on a bill that would limit the executive branch's emergency procurement powers.
Yeah, so we've been working very closely with the legislature on that. There's still some refinement that is going on and some discussions behind the scene. But in general, we support that ability to limit the length of time that the executive can use those emergency powers for procurement. Certainly in an emergency and early in an emergency, it will always be imperative that we have that ability. But we have no problem working closely with them that over time, then we go through the normal procurement processes.
Yes, Governor Cox, I wonder if you can talk about what the role of NOMI Health will be in vaccine distribution going forward.
Yeah, so that remains to be seen. What we did was we opened an RFP. We allowed everybody to come in and compete for that, knowing that at some point, either at the local health district level or at the state level, that we're going to need as many partners as possible. So that was really a preemptory RFP that went out, a request for proposal, and we had several firms that competed for that, and NOMI was the firm that was successful. They've been doing this in several other states. And so right now, the High Throughput Coalition is working with every group in the state. Again, I don't think I can overemphasize how difficult getting 150,000 shots per week into arms is going to be. It really is going to take everyone. So for example, the conversation last night, hospitals, clinics, pharmacies, and then these large high throughput sites that we're working with to really increase the amount that we can get through. And we're going to need all of those partners, including Nomi Health. So we don't know exactly right now, but plans are being put in place to use every one of those partners and then seeing what's left over. So what we've done is we've said, okay, local health district, what is your max capacity before you're unable to do all the other things that local health districts do? And they've all given us a number. And then we say, okay, hospitals, what is the amount that you can do? What is your max capacity that you can do? Okay, pharmacies, what is the max capacity that you can do? And we're working through every one of those partners. And then what we'll say is, okay, what's the delta? What's the gap? What do we have left over? And okay, Nomi Health, we have this contract. We can use you or not use you, but how can you help us close that gap to make sure that we don't have doses sitting on shelves? And that's really the role that they'll be playing, is the stopgap with whatever is left over.
Good morning, Governor. Hi, it's Sean Means of the Salt Lake Tribune. This is actually a question for Dr. Dunn. What are you seeing in Utah in terms of community spread, whether it's on the decline as the numbers indicate? If so, what regions in Utah are you seeing this happening? And is the decline because of the vaccine getting out to older populations? Or are there other reasons where other places where cases are dropping?
Sure. So luckily, we're seeing a decline throughout the state. Are seeing different hotspots than we've seen. For example, Summit County and in Southwest Utah are tending to be have higher case rates than the rest of Utah. And so we're putting extra focus there in terms of contact tracing, testing. Right now, we haven't seen an impact of vaccinations on the general population. However, we have seen it within our healthcare workers. So our healthcare workers were among the first population to get vaccinated. Most of them have received both doses, and we have started to see a decline in healthcare worker infections due to COVID. This is likely in part due to the vaccine, but also due to a decrease in cases in our communities as well. So things are looking really, really good for us in Utah as long as we continue wearing masks and physical distancing and avoiding large gatherings. That's going to be really important as the variants become more prevalent in our state. We really need to make sure we keep those public health measures in place in order to prevent another surge.
Okay. Following up, why Summit County and Southwest Utah? Why are those places being hotspots right now?
Sure. I mean, we don't have specific data as to why. It is just still community spread in a large portion of these communities. However, they are on the decline, just like the rest of the state. They just happen to have a higher case rate than we've seen in the past.
Okay. Is there any indication of when we might start seeing the effect of the vaccines on these case numbers?
Sure. Hopefully soon. Again, we healthcare workers and long-term care facilities were among the first, and we're definitely seeing a decline in healthcare worker infections and a decline in our long-term care facility outbreaks. It is going to take, getting up to around 70 to 80% of our entire population to really have the vaccine be able to be our only prevention measure for COVID-19. So we still have work ahead of us, but we're headed in the right direction.
Okay, thank you.
Good morning, Governor Cox. This is Rick Aaron from ABC4 News. A recent report from the CDC lists Utah in the middle of the pack among states, with 7.7% of the population vaccinated so far. Other states are as low as 6%. Some states are well above 10%, places like New Mexico, West Virginia, and Connecticut. How do you explain those differences among states, and what's your assessment of our vaccine rollout so far?
Yeah, thanks, Rick, for the question. Unfortunately, those statistics don't tell the story, and I can explain why, which I think is really important. The only number that we care about and the one that we look at is the number of doses delivered and the number of people vaccinated, which as of yesterday, we were 5th in the nation. Now, let me tell you why there's a discrepancy between those numbers, and that is that our population, I believe, and I'm happy to check on those numbers, that number is a percent of total population. Now, this is why that matters. Our young people are not included, are not eligible for vaccines, right? You can't get a vaccine if you're under the age of 16. We're also the youngest nation in the state, in the country, so we will always be lower on that list. But if you look at those that are eligible, right? So our adult population, we're well above 10% in the adult population, and again, 5th in the nation when it comes to the percent of vaccines delivered. So that is just solely a function on the age of our state, which is a really good thing, right? That we have the youngest. It also helps explain why we have some of the lowest mortality rates in the country, and that's definitely good news. So the number to focus on, again, because the distribution of vaccine isn't based on our population. The distribution of the vaccine to our state is only based on our adult population, which means that Utah is getting a lower percentage of vaccine as a percent of total population because we're the youngest state in the nation. So basically what the CDC has done is just said, okay, everybody over the age of 18, how many people in your state do you have? We have 10 million vaccines. We're going to divide that by your percentage of the adult population, not the percentage of the overall population. But my understanding is that that statistic includes overall population and therefore the disparity. Okay, one more, and then Dr. Dunn can keep answering questions for me. And she'll do a much better job, by the way. And she can also pronounce stuff, which is really cool. So.
Thank you, Governor Cox. Chris Reed, St. George News. A lot of optimistic talk, obviously, today as far as the increase in number of shots that will be going to people's arms. At the same time, especially those over 70, they go online Monday trying to get a slot for a vaccine, and they're usually gone within 5 to 10 minutes, and they're not able to get those slots. How can you reassure people that hey, we're going to have all these shots available and you'll be able to get them?
Well, so here's what's important, Chris. While it is frustrating, the reason it's frustrating is because we're running out of vaccine every week. Right? It's not that, people are sneaking in ahead of them or that we have all of this vaccine sitting on shelves. The reason it's frustrating is because we're using all of the vaccine every week. We are running out. So what I can do is assure them that, again, over the next 3 weeks, especially for those 70 and older who are still our number one priority right now, that as this additional vaccine comes in and other people have already gotten their shots, that more and more slots will open up and they will be able to get theirs. And that's the exciting news. So again, very frustrating. And as I mentioned before, this is always going to be the problem. We had a very distinct decision to make. Okay, here's the decision. Do we want more demand than supply, or do we want more supply than demand? And we decided we wanted more demand than supply. So the category, we could have said just everyone 85 and older, right? And then we got through them and then moved to everyone 80 and older. We certainly could have done that. But what we know is if you are over the age of 70, that is by far the highest risk category. About 73% of the deaths in our state are age 70 and older. So we picked 70, again, knowing that we didn't have near enough vaccine. 240,000 people became eligible on February 18th. Okay, on January 18th. That's when we opened it up to 70 plus. So 240,000 people became eligible, but we were only receiving 33,000 doses a week. So we knew that would be very difficult for some people. And I apologize for that, but it was a much better problem to have than what we had before, which was we opened it up to healthcare workers and then we waited and vaccines sat on shelves. And then, then we opened it up to first responders and waited to get through all of them. That's just unsustainable, and we couldn't do that, and it was quite frankly the wrong way to do it. And so now what we've done is we've overburdened the system, knowing that would cause a problem, but that we would be able to use all of our vaccines every week. So to those who have been diligently waiting to do that, but please accept my apologies. I'm so sorry, but just know that if you're 80 years old and you haven't gotten your vaccine yet, somebody else did who was also 80 years old and in the same category that you are, and that you will get yours. Now, what I am emphasizing, when we do on March 1st open this up to the next big wave 400,000 people with comorbidities and age 65 and older, is that we don't then push the 70-year-olds and older to the back of the line then, that we still, and we're working again with all of our partners to say, even though we're opening up to that broader group, if somebody is over the age of 70, they get bumped to the front of the line, not just thrown in with the mix. We're working through those details, and we'll have more as we get closer to March 1st. And with that, thank you so much for your time. Dr. Dunn will stay here and be able to answer more questions and pronounce things for you. Thanks, guys.
Hey, Dr. Dunn, this is Michael Locklear with 2 News. People on that high risk list, will they have to have a doctor's note or anything as proof?
No, so we want to make sure that vaccine administration is still very efficient. And so we're going to be relying on people on their own word for whether or not they fall into one of those severe high risk categories. So it's really important that individuals out there understand why we're doing this. So we chose those severe high risk conditions because these are the individuals through studies that have been done internationally in the US and in Utah that are at the highest risk for hospitalization and death due to COVID. And so it's very important that if you don't fall in those categories, that you don't seek a vaccine, that you save those doses for individuals who are at the highest risk, and know that in the coming months, we're going to have a lot more vaccine if the projections hold up from the federal government, that we'll be able to expand even more quickly. So the quicker we're able to get through our most at-risk populations, the quicker we'll be able to get to those who are at lower risk.
And one more, I know people are eager to see loved ones in nursing homes and hospitals. Now that many residents of nursing homes are vaccinated, will we see visitor restrictions loosened? And what about for hospitals too?
Yeah, so that's something we work with our partners on those policies, and it's something we're evaluating to see when it will be safe for both staff, visitors, and residents in those situations.
Hi, Dr. Dunn. This is Jacob Klopfenstein with KSL.com. This was probably a better question for the governor, but you might be able to answer it as well. I was wondering about what the state's plan for homeless or houseless individuals getting the vaccine. It doesn't sound like they'll be part of this expansion that's coming on March 1st, but I guess what's the plan to get the vaccine out to that vulnerable population?
So we have a group at the state and our local health department levels that are looking at all congregate living and vulnerable populations to make sure that we have the ability to reach out to them and get them the vaccine. I have to say, especially with our homeless population, the Johnson & Johnson vaccine gives us a lot more flexibility to be able to vaccinate these vulnerable populations because it's a single dose and doesn't require being frozen. And so as Johnson & Johnson becomes more available, we will be able to start actively vaccinating our most vulnerable, including the homeless. So those plans are being put in place for the moment when we do have enough vaccine to give to those populations.
Yeah, this is Paul Nelson with KSL. The Johnson & Johnson study, comparing it to the Pfizer and Moderna, it was kind of an apples and oranges kind of comparison when it comes to the effective rate. Can you give kind of a more apples to apples comparison as far as the percentage of how effective it is against the Johnson & Johnson viruses in treating just the virus itself?
Sure. So they're both very similar in terms of their ability to prevent hospitalization and death due to COVID. And that's what we're trying to do here. In the Johnson & Johnson studies, nobody was hospitalized and nobody died. So they are very similar at preventing that severe disease. And that's our goal. So it's really exciting to get another vaccine on board. Okay, thank you very much.
All right, thank you very much to our media partners. Looks like that Zoom call has ended. So thank you to our interpreters in Spanish and ASL. We're grateful for your service, and we will talk to you next week. Speaker.